Since it first broke out, Ebola has killed nearly 2,500 people in West Africa, and the three hardest hit countries, Sierra Leone, Liberia, and Guinea, have struggled to stop it. Today, President Obama outlined a major response, saying he will deploy 3,000 U.S. troops and medical personnel to the besieged countries in an effort to help contain the virus from spreading further.
This epidemic is going to get worse before it gets better, but right now, the world still has an opportunity to save countless lives. The United States of America intends to do more. We are going to keep leading in this effort.
Many Boston area medical centers are already involved in relief efforts, including Massachusetts General Hospital. That's where my next guest works on fighting infectious diseases. Dr. Stephen Calderwood is the chief of MGH's Division of Infectious Diseases and has consulted with colleagues who've just returned from Africa. I'm curious, Doctor, what this is going to do. You have these 1,700 treatment centers, about 17,000 beds, I guess, that they can, 17 treatment centers, 17,000 beds, or 1,700 beds, sorry. How do they know, to go about actually treating it? When the 4 or 5 cases that were here, is it the same protocol as the cases that they brought here, or is it really just trying to make these people feel better?
No, I think it'll be a standard supportive care, which is all we know that actually is necessary and works. But the key is to have people who are trained in what they're doing to provide that supportive care, that have the appropriate personal protective equipment to protect themselves, and laboratory testing to back up what they're doing.
I would think one of the biggest problems would be identifying the people who have it. I mean, going house to house. I mean, there are some people who realize they're ill, but not everybody. I mean, there were some pictures in the papers today about people dying on the street. I mean, how do they identify the people?
So clearly there's a major educational effort that has to be done as well. I think right now people are scared to come to Ebola treatment centers, are scared to admit that perhaps a relative is sick or has died from the disease, and that has to be really worked on hard with educational efforts. And the United States has already been doing that over the past few months, of course.
So Ebola has been around a long time, and it seems to strike little pockets, and it's very deadly when it does. But this has become epidemic. What changed?
Well, it's not clear what changed. This is the largest outbreak, has involved the most people, the most countries, and continues to spread. So it's not entirely clear why it's different. Perhaps it's because it's now in urban centers when it's often been a rural disease before. But I think we need to understand a little bit better why this is occurring so badly.
So you're also a specialist in cholera, and while this Ebola outbreak is going on, there's also a deadly outbreak of cholera in northern Cameroon. But these things kind of get downplayed when something like this, Ebola has a scarier sound to it, and people focus on that. But cholera has also been around for centuries.
Well, thankfully, the mortality rate from cholera is much lower, and with good treatment is under 1%. So it certainly is a major epidemic, certainly has to have attention paid to it, but it's probably not as serious a spreading problem as Ebola is at the moment.
So what have some of your colleagues told you who have actually been to Africa on the ground? What's it like working there?
Well, I think it's very difficult for people in this country to understand. Obviously, it's already a medical system that's very stretched with the care that they're trying to provide before Ebola, and now with Ebola, it's very difficult to provide the care that we would like to see provided. So I think the idea of the U.S.-based treatment centers and then the international community and the UN-based treatment centers, hopefully as those get built, is to really help educate healthcare workers there and bring in the needed supplies and manpower to actually get the job done.
I mean, we heard some bizarre statistics that sounded almost too crazy to be true, that if you took one floor of doctors of Brigham and Women's Hospital, there are more on one floor there than all of Liberia. Is that possible?
I guess it depends on how big the floor is. I'm not sure whether it's quite correct or not. But yes, there's obviously a scarcity of doctors, but also other healthcare workers as well in many of the areas that they're developing.
Yeah, I mean, because they're also dealing with all kinds of other issues. It's not like they all want to run to help people with that disease, as we've seen. I mean, it's terribly frightening, and people, you need all the coverings, and it's not like being in a maternity ward.
No, you're absolutely right. And of course, they have many other diseases to deal with, malaria, typhoid fever, bacterial infections, malnutrition, cholera, as you pointed out. So yes, this is occurring on top of a very difficult healthcare situation to begin with.
Is this contained right now to Africa? Could it easily spread to the United States, Britain? Could it spread?
So it's contained in the African area at the moment, yes. There are the possibility, of course, that people traveling from Africa could bring it here. I don't think there's any serious risk of it spreading widely in the United States, because, of course, we can isolate and care for people here in an appropriate way. The concern, of course, is that it will continue to spread in Africa and cause more serious damage than it's already done.
All right, Dr. Stephen Calderwood, thanks so much for coming.
Thank you.
Appreciate it.